welcome back to Baby Bump Life. I want to take some time to talk to you guys about pushing, lacerations, and episiotomies. Not something that's super fun to talk about, but something I think is definitely necessary and things for you to consider. When it does come time to push, you want to be as in much control as you possibly can. And you want to be able to listen to your doctors and nurses during that time because they will assist you in how you should be pushing. I know we've talked about pushing before and I gave you 3 good techniques on things to do. You can definitely check that video out and I'll put the link below for my pushing video. However, when it also comes to pushing, a couple things that you can try. You can ask your nurse to put a warm washcloth down below. It kind of helps with some of the stretching. So putting a warm washcloth down there. The other thing that you can ask your nurse to do is a little bit of a massage on the perineum. So just kind of massaging and allowing kind of to stretch a little bit as the baby's head comes down is good. Other things that for the most part your nurses should be doing, but you can ask them as well if they feel that it's safe at that time. Once you are completely dilated, if baby's head isn't sitting right there, meaning that your nurse can't see it right away, you could ask them if you have the opportunity to labor down. Laboring down is where your nurse will simply sit you straight up, or as much sitting up as you can, with your legs kind of out. We call it the queen's position, so sitting straight up and just allowing gravity to do its thing and baby's head to come down. It'll allow with some stretching as well. So you can ask your nurse those couple of things if they're able to assist you with that. So the warm washcloth, the perineal massage, and sitting you straight up into the laboring position, laboring down position. So a laceration, or also known as a tear, things that you do have control of with that is how well you're pushing and listening to your doctors and nurses. So you may tear and it may happen and there may be nothing you can do about it, but sometimes you do have a little bit of control. If you are going natural, I realize that it's the hardest thing to do is to listen to them when they tell you to do a small push or a great big push, but your doctors and nurses are down there. They can see everything that's going on, so you want to listen to their advice best you can because they don't want you to tear as much as you don't want to tear. So they're going to tell you what types of pushes they want from you. So if you can, if you're in well control of your body, then you want to be able to listen to them because they can decrease those chances by telling you what type of push. Or hold on, don't push right now. Just breathe for a second, and baby's head will kind of stretch a little bit. So even though it's the hardest, it's the best time that you want to have the most control. And then the third thing that we're going to talk about is episiotomies. We talked about pushing and things you can do to kind of help decrease your chances of tearing. We talked about tearing, or also known as lacerations, and things that you can also do right at that moment of pushing the head out. And then an episiotomy. So an episiotomy is a surgical cut, basically, where the doctor kind of extends a little bit because they can tell at that moment that the baby's head is going to need a little more room, a little more assistance from you. Some doctors and nurse midwives, they feel at that moment it would be better to do a cut rather than a tear because they went to school, right? They have practice. They know at that moment if it's going to be a larger tear or if they could do a nice cut, which they would be able to suture up much faster and they feel would possibly be better for you to heal. So it's where you're really entrusting care in that doctor or nurse midwife, and it's the reason that you chose them as your doctor or nurse midwife. So the episiotomies, I don't always think that that's necessarily a bad thing because like I just said, it could be that that is a straight cut rather than at that moment the doctor can tell, oh, if she keeps pushing like this, it's going to be a very hard tear. So sometimes it's a better decision. And of course those are things that you can discuss with your doctor or nurse midwife at the appointments prior to delivering and asking them what they think is best. Most of them will tell you they don't know until that moment because that's true. They don't know until baby's head is coming out. They're making that split decision for you and they're helping. There's chances you may not tear at all either. There are some moms who don't tear and they have what's like a little skid mark or like a little rug burn. Nothing that quite needs a suturing, but something that would just heal over time. So I hope those things help about pushing, lacerations, and episiotomies. And I wish you the best of luck in your labor and delivery experience. Thanks for watching, guys. Until next time, have a good day. Bye.